Obviously today we are here to discuss shielding for Northern Ireland. My name's Jo Peplow, as I said, and I'm the Patient Service Manager here at Leukemia Care. So if I could first of all just ask the guest speakers, to introduce themselves. Nick, do you want to go first?
Yeah, sure. Hi, I'm Nick. I'm a patient and have the pleasure of being question master today. So I'm a CLL patient and work with Leukemia Care as a patient advocate.
Thank you, Nick. Mary Frances?
Hi, I'm Mary Frances McMullen. I'm a consultant hematologist, an academic in Belfast City Hospital and Queen's University Belfast, and I have particular interests in acute leukemia and myeloproliferative neoplasms.
Thank you very much. And David?
Yeah, hi, I'm David Donaldson. I'm a consultant hematologist also in the Belfast City Hospital, and from a leukemia point of view, I look after patients with chronic lymphocytic leukemia and other lymphomatous disorders.
Thank you very much. And today we've got an added bonus if we've got Caroline with us. Caroline, would you like to introduce yourself?
Hi, I'm Caroline Kerr. I'm the clinical nurse specialist for the myeloid and leukemia team in Belfast City.
It's going to be great to be able to get their thoughts, especially from their specialist groups, on how everybody's doing in the current crisis, and how we sort of envisage moving forward. As Nick said, he's also on here. He's very experienced in advocacy, and he's there today to help us with the questions. Shielding. As we all know, back in March, we were told that anybody that was deemed highly vulnerable to COVID-19 would need a shield. At that time, this included people, as it says on the slide, anybody with cancers, bone marrow such as leukemias, lymphoma, myeloma, and because obviously they were trying to be very cautious, they also said at any stage of treatment. And as we know, as time's gone on, things have changed slightly. And I think we've got to the stage now where we're looking at how we move forward. As I said at the beginning, risks seem to be decreasing, and obviously you guys in Northern Ireland you've been probably in a better position than say we have been here in England. And then we need to now look about who should and shouldn't shield. Obviously, everybody's different. If you have got any questions, or you should speak to haematology teams to make a decision as things start to change about shielding and guidelines. Be mindful that there are people out there to help you. Also, just to make it clear that as though we've got questions, that individual questions unfortunately won't be addressed on this forum, but Nick will do a fantastic job of trying to get everybody's questions through without actually going down an individual way. Though we have got other parts of the team which I'll come to later on when we finish, some of the avenues you can explore within Leukemia Care for support. So will this continue? Well, I know initially it was set out for 12 weeks. And we've now seen that it's likely to be until the end of July. Essentially, England has just announced it. I know it's not, the guys might tell me differently, but at the moment it's looking like in Northern Ireland you will follow suit, and that things will be put on what they call pause. Essentially, government support, etc., will end at the end of July. So obviously we need to wait and see what happens with that. I know that you've had quite a lot of changes. For example, things that you can do now, and we're looking at the future. So this has changed quite rapidly for you. So on the 8th of June, you had a slight change whereby you could, yes, you could go and see one person outside, but under strict social distancing. But it's also been stressed that it's very important that you avoid any indoor spaces. So that's everything down to, like, even don't shop, don't go to anywhere, even just for essentials. So that was a change for you. However, if you were asked for a medical appointment, it is quite safe for you to go and do your medical appointments. And I'm sure the guys will touch on that when they give us their updates. You've now moved on, and as of the 6th of July, which is not that far away, you will be able to see people, up to 6 people outside. However, that is still under strict social distancing guidelines. And also for those, same as we've had recently, anybody that's been on their own, they can have a support bubble, which will probably be really helpful. I know the guys that have started doing that have found it really, really useful. So just a couple of comments on that. For the support bubble side of things, like I said, social distance is not required with the other house in your bubble, but you need to spend time, from the 6th of July, you will be able to spend time with the people living in the bubble. It can be a second household of any size. Both households should not be a part of more than one bubble. So it's definitely just coming into a new little group, but keeping that group as a minimum. So a lot of the time we're asked about, well, what happens if there's other people in my household? Social distancing is still very much a major part of this, especially if you've got somebody in your household that is leaving the house to maybe go to work or is, out doing more things. So what we advise is that you use shared spaces at different times, things like bathrooms, kitchens, places where you maybe spend a lot of time or need to spend more time, and make sure that you clean clean up the areas between uses. The other thing that we recommend is to use separate things like dishes, towels, clothes, just to reduce the risk, and to stay at 2 meters apart at all times. And where possible, and we do appreciate that in some, it's not always possible for some of the things I've just mentioned to sleep separately as well. And at the moment, there's no date to change this. So, like I said, I've gone through this again, but I think it's worth reiterating because it's something that people aren't sure about. 6th of July, your support bubbles come into effect. Meet one person outside if you live alone. Meeting others in garden and in a garden or at home is still not advised when you're shielding, and certainly nobody should be allowed to stay overnight in your house or as a guest. I think it's worth pointing out that shielding is not actually a law. Some aspects of general lockdown were more enforceable, but I think you have to make sure you do what's right for you. Things are moving quite fast in other areas, different parts of the UK, and it just really depends on what's right for you, how you interpret the guidelines, and certainly speak to your clinical team to get their involvement in your own individual situation and your medical history. Now, one thing that comes up quite a bit is healthcare changes. Because what we're finding is people, if they think they're under the weather or they've got a change in their health, that they're maybe not seeking medical advice. And what we urge people to do, especially if it's something new you've not seen before or a particularly worsening symptom, is to actually make sure you contact your clinical team. The guys in hospitals are working extremely hard to make sure that everything is safe. Things like zones, there's zones for people. They also will use PPE, so they've got into a way of working where it's really safe. The other thing is, if you do know people that have been for hospital appointments or been up to the hospital for anything, have a word with them, because I know the feedback we've been getting back at Leukemia Care is that it's very well organised and it's a very safe environment. The other thing I'd like to just point out is that obviously, because people are not perhaps people that may present with leukemia aren't going down the clinical route to find out if they have got a problem, we are still running our Spot Leukemia campaign that we run every year in September. So we would encourage you to share positive stories with people, so it's not so scary of the hospital route, to make sure that if anybody's got any concerns about having a leukemia, any symptoms, to either go to the GP or the hospital. So yeah, if you can be part of our Spot Leukemia campaign, that would be great. So that's just a basic overview from me. I'm going to pass over to Mary, who's going to give you a little update from what's happening in her world and some advice for you all from a Northern Ireland point of view. Mary.
Hello. Hello. So from 2 points of view, first of all, from the acute leukemia point of view, this does not wait for any epidemic or anything else. So we have been open for business and treating patients as normal, as required, right through this area. There have been some changes in the hospital. The ward has been moved to different places, but we're now back into our main ward. Sometimes restrictions on visiting, but we've got round those when people are very ill. And treatments have been delivered. There were a few things delayed earlier on where they could be, but everything is delivered and is up and ready for business. And make the point also that any patient who comes into the hospital for treatment of any sort goes to one particular area, has a screen done for COVID, and they only move on to their treatment and the main areas whenever we get a negative result. We're very lucky in that we haven't had any patients with COVID in the ward, where a couple of people came positive on screening, went home, came back a couple of weeks later and got their treatment. So that's the acute leukemia point of view. The other large bit of my work is in outpatients. I have a big interest in myeloproliferative neoplasms, and we have lots of patients with chronic myeloid leukemia. Now, we did have to put some changes initially when this all started, because the hospital was greatly reorganized. A lot of patients had their appointments either postponed, or they had treatment sent out to them so that they could miss an appointment, or some of them just had their bloods and then were contacted afterwards. Some people were spoken to on the telephone. All of that was initially to try and keep patients away from hospital and to reduce the footfall through the hospital. But we're now almost back to normal. My clinics, I'm seeing all the reviews, I'm getting them all back. There are some things that have come in as slightly different ways of doing things, which I think are actually going to be very useful. So some patients came, had their bloods done, sat around for a long time, and then got to see me where you got at least 10 seconds while I said your bloods are okay. Many of those we'd now say, we'll either have your bloods done and then go. Again, that keeps less people hanging around the hospital. Or sometimes there are other things where we will get them to have their bloods done in the community and contact them. So some of this has brought in things that have possibly improved our practice and improved our workforce. But we've now got all the routine patients coming back in again. Everybody's got their medication on time. They either get spoken to or they get a letter following the clinic with the results. And we're more or less getting back up to where we were before, and hopefully from my point of view with no great backlog. The hospitals have been very well arranged. There are very careful ways to keep everybody safe as they come in. First of all, the staff. I remember the days when you went to the hospital work, even when you had the cold or something else. You wouldn't do that now. If you're not well, the staff will not come anywhere near the hospital and will be screened beforehand. Then every patient coming into the hospital gets their temperature taken and then has to wear a mask. Anybody who has any temperature is then not allowed into the hospital but sent over for a COVID screen in an entirely different way. So there's huge amount of efforts in keeping the hospital for the non-COVID patients extremely safe, and also to keep them through, to keep them distanced, and to get them in and out as quickly as possible. I think those are the main things about this. We are open for business. We are hopefully seeing our patients. I think the one thing that worries everyone, although it's probably possibly less a problem from the acute leukemia point of view, is have patients actually been coming to the hospital or to see their doctor if they're unwell. And that was what I would very much say, we're open for business. You will get tests done very quickly. I know that the A&E numbers have actually come back up, but there was a period where there were very few people going to A&E, but they are there, again, open for business with the same idea of getting everybody through and screening and not sitting around. And the GPs also are very keen to see people that may have different ways of doing it. A lot of it is speaking to people on the telephone and only bringing them down if they think they need to be seen. But people with symptoms or signs should be very much encouraged that everybody's there waiting for them and the systems are safe. And the final point I would make is that we are perhaps very fortunate in Northern Ireland. We were all terrified and told about the first wave, which was going to be dreadful, but the first wave, well, this sounds cynical, we'll say we're still waiting for it, because although we did have a number of COVID patients and it did spread a bit around in the community, I think the shutdown was actually very good timing for us, in that it was shut down. I know in London that was already well spread in the community, but it wasn't here. So Northern Ireland was they never used any of the extra ventilator beds. Although there was a lot of people, the numbers were small. It was a problem with old people's homes. I think there is an issue there that has to be learnt. And now there are very, very few patients. There's really no COVID, as far as I can see, circulating in this population at all. The numbers of new cases each day are in single figures, so they're really only the one person who's exposed to somebody in their house 14 days ago. And provided no more comes in, I think it's very reasonable to accept that there's really no COVID circulating in this community. Obviously coming in is then the issue, but the contact tracing in Northern Ireland, it's not often Northern Ireland gets it right, but I think somebody was way in front and has good old-fashioned contact tracing set up in Northern Ireland. If somebody is a positive test, they're getting screened. I do think there's so many people employed to do it that they're sitting looking at each other because there's so few cases. So the idea would be, we've been threatened with a second wave. I hope that we'll get at most a second ripple, that a couple of cases will appear somewhere. They'll get contact traces and shut down very quickly. We saw that happening in New Zealand, where they had absolutely no cases. Obviously it will see, but it's not America. We do not have idiots who let it circulate everywhere before they did anything. So I think it's important to remember that. I'll stop talking.
Thank you very much. That's great. I'm going to pass over now to David, because obviously he's in a different clinical setting, to give an update on what's happening and how he thinks it's going to move forward from his side.
Okay, thanks very much. So I suppose from the chronic lymphocytic leukemia point of view, a lot of what Professor McMullen has said will apply, so I'll try not to repeat anything. We do advise our patients to follow the government guidelines, and we have thankfully been able to continue with treatment in the majority of our patients. This is an individualised decision, and it was made after discussion with each individual patients. I suppose we were most concerned about comparing with the acute leukemia side of things, a lot of our treatment's given as an outpatient, and we would have been concerned about the more intensive regimes we'd have used, and we were prepared to deliver those if required. A lot of our patients would be treated within a trial, so it was a concern how the trials would run, particularly the FLAIR trial throughout the COVID period. But the trial people were able to be flexible, and we were able to keep people on trial throughout. A lot of our patients will be on oral treatment, and as with the chronic myeloid leukemias, we were able to deliver a lot of those treatments to people's homes and get their bloods done remotely, so really minimising clinical contact and allowing people to continue to shield while remaining on treatment. As Professor McMullen has said, we are now back up to our normal workloads. We've been able to adapt our outpatient unit to manage and minimise the risk in terms of social distancing. I would envisage from the CLL point of view, we will continue to do more work remotely and going into certainly this winter and beyond. In terms of remote, we have a remote blood service, and we are continuing to deliver treatment to people's homes where it's safe to do so. That doesn't mean that we won't be available to see patients face to face when the need arises, or if patients wish to see us, we have an open door. A lot of our patients will be on immunoglobulin replacements due to immunocompromise. Thankfully, prior to COVID, we've moved a lot of patients over to home intravenous immunoglobulin administration, and that has been able to continue throughout the COVID pandemic. For our patients who are getting intravenous immunoglobulin in a hospital setting, and that was paused in most cases after discussion with the patients, as it was felt that shielding would give the same protection that the IVIG normally would. In the majority of patients, that has resumed in hospital over the last 2 to 3 weeks. So I certainly think in terms of having the remote blood service and the home delivery service, that we've actually been able to introduce some benefits for patients as a result of the COVID-19 pandemic, and hopefully be able to maintain these going into the future. And again, reiterate what Professor McMullen says, that we are open for business. If patients have symptoms they are worried about or wish to see anybody, we're here. And yeah, we can see patients when required, while adapting our unit to maintain a safe environment as we possibly can.
Thank you very much. Caroline, have you got anything to add from a CNS point of view?
From the point of view of the patients, I think for them to know what to expect whenever they come for an outpatient appointment. So, for example, if you have a patient that wants to see Professor McMullen or Dr. Donaldson, what they expect. So they would arrive at the hospital. There's only one way in and one way out for these patients. They come in and they get their temperature taken at the front door, get their contact details and their date of birth. And from that point of view, if there was anyone eventually that ended up with COVID, that they could, all the patients that are in contact with them could be traced. So I think that's important to start off with. Whenever they would go up to the outpatients department, the seats are all taped off where you can maintain social distancing. Staff are wearing appropriate personal protection equipment that are equivalent for the patient, disease or risk type. And you get your bloods checked, and then you can either, depending on what the arrangement is with your consultant who has already screened the clinic before you come, whether you need to go home or not. If at any time that you need to see the consultant and that you want to speak to them, just make it known to the nurse that is working with you, and they are very, very happy on all of the times to see you as soon as that they can. Don't forget also that you have the CNSs in all of the units. Not only is Belfast City got a team of CNSs, as does Antrim, Craigavon, Ulster, Altnagelvin. So contact them if you have any queries. We are all available on the phone. And if you have concerns about coming into the hospital, ring us. All of us do telephone clinics, and we can talk it through with you. As Dr. Donaldson has said, we have been, one of the positives has been that we've been able to get our long-awaited delivery service for treatments for patients up and running, and we certainly hope that that will maintain after the COVID pandemic has settled, because for patients that's absolutely fabulous, especially those who are coming from some distance and have to wait traditionally around for a long time for medication that can't be ordered before their blood tests are received. So I think from a hospital experience, it's as safe as it can be. And we're learning every day and everything's changing. But if you're worried at all before your hospital appointment, give us a wee ring. I think from the point of view of being at home, try to eat well, try to get out into the garden to get a bit of air about you and get a little bit of exercise. You know, your positive mental health is very hard in this situation. People become very isolated and very lonely. So use the social media, the like of Zoom, and social media has come into its own in this pandemic. But you know, take up new hobbies. Think about things that you would do that's not going to you know, exhaust you. I was off for a period of time and I took up embroidery, and it was a great job. So, you know, books that you want to read, hobbies that you want to do to keep your mind active. And Leukemia Care are there. There's forums there and helpline there. That if you need someone and you have concerns or worries, lift the phone.
That's great. Okay, so I'm going to pass you over to my colleague Nick York. I'm sure he's had lots of questions coming in, and he'll field some of the questions. Thanks, Nick.
Good afternoon, everybody. It's nice to be with my friends in Northern Ireland. I think from a patient's perspective, listening to what Mary, David and colleagues have said, is that it's a really encouraging picture, listening to actually what seems to be the level of infection that is out in the community for you at this moment, and how quickly you managed to get services back to normal, and obviously a new normal. I'm just wondering, the first question, if it's reiterating what Mary said before, is people, it's not been long since children were suddenly given the shock news that, oh, we could go out for exercise, and the picture that we've been in was everything is extremely dangerous and extremely risky, but obviously that's not the case. What is the level of infection within the community? I mean, is there a way we can put that in perspective to ensure that there is vigilance when people are out? Should patients, when they're out exercises or they're out with another person, employ any particular strategies with regards to their safety? And what's the likelihood that they would bump into somebody or encounter somebody that could be infected? Are you able to share that kind of information, Mary?
Will I try that first? So the point is, in Northern Ireland, I mean, over the last couple of weeks, there's only been 2 or 3 new cases a day. Now, that's opposed to in England, where you're talking about thousands of new cases a day. There's also very good screening. Anybody who wants to screen is getting it and getting results very quickly. So they're actually, I mean, I think it's very reasonable scientifically to conclude that there's really no COVID circulating in the community now. There certainly was back in February and March. People came from Italy and it was round, but the shutdown came, it was almost as if it was 2 weeks earlier than it was done in England. So it was shut off earlier, and it never, when we were waiting for this peak about the 8th of April, and it never really peaked. It just sort of went up a bit and then down a bit. But over the last, the deaths, there's many days there've been no deaths. There's 1 or 2 each day. And the pattern has been very much actually that there isn't any. And I think you could also say the south of Ireland is the same. I mean, the pattern over the whole of Ireland has been the same. As I said before, care homes were a problem. So once you get it into care homes, that's a huge issue. But that's all in control now. So what should you do? Well, the government guidelines are, as you've stated, but I think Joe made a very good point. They are guidance. And then we say, get a walk in your garden and so forth and so on, if you have a garden. Northern Ireland, we do have lots of open and outdoor spaces, more than perhaps in other places. And I think that's all of use. I mean, I certainly think people who don't get any exercise, it's not good, and no fresh air. So I know what the guidance says, but I would be encouraging people to try and get a little bit of exercise and get out. What should you do? We all have to social distance. Even I know Caroline's beside me here, but we're very trying to keep the apart, because what you're doing is you're assuming, okay, there's no COVID circulating, but what you're trying to do with that is that if there was anybody, you're not getting close enough to get it off them. And I quote a story about this that I always think is very interesting. I was listening to the radio at about the beginning of the end of March, and there was an opera singer on. And so, how are you managing going through airports and things with all this social distancing? And she said, well, I'm an opera singer. I can't afford to have the cold or the flu because it's an absolute disaster. So I've been practicing social distancing for years. I never go near anybody at an airport or anywhere else. I don't go up and hug people. I stay apart from them because I don't want any infections. And that's worked for years. So that's what we're trying to do. all of us, all of the time. And that is very interesting because there's no colds and ordinary flus and things going around at the moment. You know, nobody has any of the things that you usually get because we're doing a different way of life. And I don't know how to go forward, but I think it will go forward to some extent. I can't see that in the future we'll be back to hugging every person we see without knowing where they are. So there'll be some social distancing. So I think people, when they do go out, they want to keep the distance from people. I've lots of opinions on masks, but I think, you know, you do want maybe to, certainly on public transport or anywhere where you were going, you want to wear a mask. What else?
I think if you're going to be indoors at all,
yeah, you
need to look at that and say, right, that's a possible risk. Not so much on an outdoor. I think there was two COVID cases yesterday in Northern Ireland, and they've been in single figures for a long, long time. So whenever you're indoors, you can't take that risk. Have the mask on. And it's very difficult because no matter how many one-way systems you put in shops, there's always the one person that goes the opposite direction. But try to keep your distance from everyone. But it is difficult. And it is worrying, and it's worrying for all of us, but more so those with some kind of blood disorder. So, you know, carry your hand sanitizer, wear your mask, keep your distance. But you need to be out in the fresh air too. There is some evidence about vitamin D that's been bandied about, but we're all low on vitamin D anyway, and we've had the most glorious spring. So get out and try and enjoy some of that air while keeping your distance from everyone.
That's excellent. David, got anything you want to share in that area?
No, that covers it.
It really does, actually. It's really uplifting listening to this conversation. And I think, Mary, you hit on something there that's really interesting. As blood cancer patients, we're already pretty expert at social distancing.
Yeah.
We kind of went into this, and I have to be quite frank, you know, at a personal level for me, going into shielding, although it brought back memories of time during treatment, it isn't that different to how I've always maintained, you know, I've always been concerned. And I think a lot of patients have always been concerned about travel on public transport, working in large groups. You know, so sticking firmly to hygiene strategies, that was the first thing I ever learned as a patient, actually, when I was diagnosed and I had to understand, what does CLL mean to me? Oh my God, does that mean I've got a really badly damaged immune system? Because that's one of the side effects of living with this condition. And the idea was that at that stage, it was a bit of and still is a bit of a one bucket fits all kind of diagnosis. Nobody really knows early on until they've experienced repeated infections or things of that nature, how compromised their immunity is. So there's always been uncertainty. And the advice I was first given by the first charity I joined was hand hygiene and employ hygiene strategies regardless. So I think as long as we follow those and listening to the prevalence of the infection rates, it's a really uplifting picture, and I think people can feel confident. I have got an interesting question though. Bubbles. Bubbles. Yeah, we're all talking about bubbles at the moment. The concept of bubbles, is that coming in, Joe, on the 6th? Is that the 6th of July?
Yeah, 6th of July.
Now, this kind of goes against, again, what we've been taught and told with regards to the guidance. I'm still being told, quite rightly by yourselves, that it's, you know, summer, forests don't live too well outside. Likelihood of you encountering something outside, as long as you avoid crowds, is good, but don't go indoors. But now this, am I right in believing the new idea of bubbles is you're allowed to spend nights together under the same roof? And are there special strategies that we should consider here?
So I think it's difficult. I'm not entirely sure which particular rule we're on at the moment. It does keep changing. I think the one that, I mean, you could spend somebody under the same roof. I'm afraid my daughter said to me, yes, that's so that we can have the sex back. Thank you. That's more than your mother wants to hear. But, you know, it's trying to get a little bit further to allow people a little bit more freedom, but and in the same time to try and, you know, you're not going out to meet everybody, so it's a small group of people. And I think the bubbles will come. We're talking about the university students and the schools going back where the people, where they're a smaller group, that they're all the one bubble. And again, it's all trying to, you know, you're not exposed to everything, to keep a smaller group of people. But which particular role we're on this week, I find difficult.
As you quite rightly say, as blood cancer patients, you are used to having a smaller social bubble anyway. Yeah. We always tell our patients, you know, any snotty kids, send them home. Any grandkids, send them home. Don't go near anybody with any temperatures. You're already experts, far better than we are, about doing it. It's us that are having to learn the social distancing and the bubbles. So I think it'll be lovely for everybody to be able to get some kind of normality back where they can interact with other human beings. But I don't think it'll be vastly different from what people have been doing beforehand of the blood cancer diagnosis.
That's really helpful. Listening to a patient when we were first having to go into lockdown, I remember that person saying to me, I'm going to have to be very choosy of who my friends are that I associate.
Yes. Yeah.
And
it's for somebody that you don't particularly get on with.
Yeah. It can make the situation handy, I suppose. So being mindful of who the people, you know, if you're connecting with another people, then you want to be sure that they're not associating potentially frivolously with too many other, you know, that's just socially, you know, that you're aware of what their social contact background is to minimize your own risk. So although we can't have herd immunity at the moment, that's almost a form of herd protection, I suppose. Is the way of looking.
And careful to choose your friends and what they do and so forth and so on. I mean, I always think my next door neighbours actually don't speak to me because they know I work in a hospital. But, you know, they're coming round, but it's taken a while. But think of who in the bubble and what their exposures, because it's all about trying not to get exposed to anybody who just possibly could have COVID. Because all of this, the shielding is to try not to get COVID in the first place.
Yeah. It's a really interesting topic. I kind of relate it almost a little bit like diagnosis again. If you're diagnosed with I live with a chronic condition, obviously it's a bit different with the acutes because it's not a lot of time for getting used to the diagnosis and having to deal with the challenges. You know, you're into action in the majority of cases. But the baby steps of, you know, learning your way through. And I think the question I need to, maybe from this listening to you, is emphasizing that this is guidance. You know, it's not a book. You don't have to do it. So if you're told you can, doesn't mean you should, you know. And therefore other peers and people in your family shouldn't be in a situation where they can pressure you into having to do this. People have got to be mindful and respectful of that. And I think also it's a common sense issue as well, isn't it? I think we're adults, everybody, you know, that there's an issue of discretion that people need to go at the pace that suits them.
Mm-hmm.
Yeah. Okay.
Absolutely. And I think it is very much guidance. You know, these rules have been put together in order to try and keep people who are perceived to be more at risk, to try and stop them getting COVID in the first place. But they don't forget they were put together with no knowledge or evidence. They were just working out sort of from, well, people who have been at risk of previous infections. And it is trying to get some way that's best for them. And I think it's very important they exercise the mental health, etc. One of my patients told me that this was all very fine, but she wasn't, she could not stay in the house for 12 weeks. So she was going out at 6 o'clock every morning for a walk before there was anybody around. You know, and that to me is very common sense. You're keeping to the spirit of the thing, but you're avoiding people, but you're still getting out and exercise. So it is guidance, and it's what's works and what's best for an individual.
So the question there is, for those that are feeling the mental stress of having been shielded for a long time and are quite rightly anxious of really engaging and unsure of their situation, your advice is that patients contact you, contact their care teams to discuss this so that you can help put things in perspective for them?
Absolutely. And we've had many conversations with people both at the beginning and through, and we'll have them ongoing. I think what we do need to do, and I think we were all doing it at the beginning, is to try to reassure people as much as possible. Everybody at the beginning, including ourselves, was completely terrified by what we heard was coming and what we were told was coming. There was a public health message put out there, which I think was as terrifying as possible, because they wanted people to distance and to shield. And, you know, while we're all good law-abiding citizens and do what we're supposed to do, there was very much, you know, you make it as bad as you can so that people will stay at home, shield, keep their distance. But that has been, for some people, extremely frightening. And I think we all need, that's what we were trying to say, the hospitals are safe, we are open for business, there are people there to help, and we need to, I think there's a lot of work to be done to get that to some people who are so frightened by it all that they don't realise, you know, that a risk is not an absolute. You know, a risk is only that it's slightly more likely to happen than if the risk wasn't there, not that it's going to happen. But that'll be a long process, and I think there's a lot of problems for people for a long time because of that.
Picking on the same topic then that's coming from this is the health and mental well-being of patients. Chronic patients, very familiar with the challenges, and yourself with CML and the CNS of patients living with long-term issues. What are you able to offer, you know, to those that may be struggling a little bit? I mean, I can see similarity to this. I reached out for counselling, for example, when I was going through chemo the first time. I think I was headed for a car crash at the time with a divorce pending and a few other things at the same time as going into treatment. And that really helped me take those steps through the transition, through the change. Is there other resources available through the healthcare system that can help patients take these steps? Because you're right, the conditioning, we've been conditioned, we've been told, and been given clear messaging about the risk. Now that risk is obviously, listening to yourself, it's phenomenally, it actually does ask the question, some people are asking, should I continue to shield? But obviously, following guidelines and staying away from crowds. So the first question is to you, are you able to provide support in this area? Are there services available to patients in Northern Ireland clinically?
So the services that we had in Northern Ireland were actually quite poor. Unfortunately, we, unlike some of the units in the mainland, we didn't have clinical psychologists on hand. We do have a clinical psychology team, but they, like everyone else in the health services, snowed under. So I am hoping that because of the public's perception and the fact that it's well known that it has affected so many mental health, you know, have just brought up so many mental health issues for people, quite rightly so, that they'll invest, the health service will invest some money into the health service for clinical psychology, because we are very much relying on the charities with running buddy programs and telephone buddies, forums, expert pages, things like that, to get you guys the support that you need as well as ourselves. And the clinical psychology team here in Northern Ireland work very, very hard, but it's only a drop in the ocean from what is out there. So I'm hoping at this stage there'll be acknowledgements from the government that we need to invest more money in this area, and we would be looking to get charity funding and everything to do that, and to push the government to provide that, because it's something that, as Professor McMullen says, will be ongoing for some time.
I think in the acute situation, the GPs are now very good. So I've had various reasons to contact GPs about this, about various people, both in haematology and beyond. And because they have reorganised their service, taking messages, phoning people back, they're actually very onto it, and onto referring people on and knowing how to do it and get through the situation. That's my experience. David, I don't know whether, because you've got the chronic group of patients as well, what you can provide for them.
Yeah, so I think the clinical psychology is brilliant for people, but as Caroline says, it's a very limited resource currently, and the waiting lists are long. I think having the clinical nurse specialist team here is invaluable as a point of contact for people who are struggling as well, and certainly it helps to talk. And I think as a consultant group, we've tried to be as available as we can be for patients throughout the crisis as well, so people don't feel that they have been abandoned while they've been shielding. And I know our local, Macmillan offer good support for patients as well. So yeah, I think while resources are limited, that we are here for people, and there has been support for them when needed. And yeah, I would agree that the shielding had a significant impact on people's mental health, and any of the remote telephone conversations often focus on that more than the patient's physical health currently.
That's really interesting to hear, and I think the patient surveys that we've run with the help of everybody that's on the call have reflected that. But do you know what really has come through that you'll find really encouraging as the physicians is the feedback in the surveys confirms the great job you've been doing at keeping connected with the patients. Patients have actually become less concerned about their care as time's gone on, although they've been obviously more impacted by the emotional, psychological issues of continuing. So you talked about health and you talked about psychology. So Joe can touch on some support that we can also help in liaising with yourselves, and also about support groups in Northern Ireland. I mean, from our point of view, we have capacity at the moment we have the Anne Ashley Counselling Grant that's available to patients that might want some help in this area, where we can fund a referral to a counsellor for 6 sessions, I believe is the case, as well as we've got a very extensive buddying scheme. So that's an area that Joe can expand on in the end, and I think that's probably really relevant for this moment in time. I mean, it's a really uplifting picture, and I'm so privileged to be with you, with my friends, listening to. It is a bit different here. I feel like I would like to come on holiday at the moment and come over to you. And on that note, we've actually.
I think Northern Ireland is open for business for holidays very soon.
I mean, at the moment, we've got a question on that, which is actually, what are your view about vacations? Now, we've got a challenge, haven't we, with regards to public transport and where we are in the shielding journey. I suppose we've got to look finger in the air a little bit. You know, we're all going to have to resume our activities. I know I was shocked when I saw the England letter when it came through the post. It was a bit final, and it just says shielding will pause on the 31st. You should now go back out to work and should now be going back to the shops at that stage. You know, but of course you don't have to. So what are your views about what's going to happen? Are you able to share? I know it's a bit crystal ball, because people, parts of health and well-being, people want vacations, they want breaks, they want holidays.
So I think it's very difficult, and it keeps changing. You know, there were all these plans. The South of Ireland had plans 3 weeks, and nobody was going to go on holiday until the middle of August, and that's just within Ireland. And now the hotels are opening 29th of June. So next Monday, the hotels, campsites, etc. are opening in the south of Ireland. And it does keep changing. I believe if you're in Wales, you can still only travel 5 miles. They haven't changed that, so they're not going on holiday. So, I mean, I think, you know, who knows? And the other bit, of course, is, well, as far as I'm concerned, nobody can go abroad if you have to sit in the house for 2 weeks. When you come back, they've got to get rid of the quarantining, even with corridors. I think I mean, I'm sure, I think we're all thinking of where we can go on holiday. I have a house in Donegal, so I know where I'm going, you know, and that's where people will be going. I wasn't joking when I said I think Northern Ireland will be, you know, will be open for business for people on holidays. And the south of Ireland, because don't forget, Ireland is, the whole of Ireland is part of the common travel area. How you're going to get there and what it's going to be like when you get there is an issue. You know, are you going to go in the car? I think when you get to these places, they'll be quite, you know, it's not just let's go down to the pub and have our dinner. You know, it'll be booked, it'll be social distancing, it'll be you know, very controlled in a very different atmosphere. And as I say, I think the self-catering people will be really doing well, because that's where people will start. When you start doing that, I don't know, the letter at the moment is reported to say continue to the end of July if you want to. But and I see somebody said they haven't got the letter, and that's typical. You know, by the time the letters get out, it'll probably be halfway through July, and they might change it again. But I think it is back to the point that we were making. There's virtually no COVID here. You know, do people not want to get up and about and get on with their lives? The going back to work bit is important, because it does, as I understand, say your workplace has to be safe.
Yeah.
And I mean, I know I work for the university. It's going to take them way beyond the end of July before they have worked their way through and made sure that all the areas are safe. They're saying, you know, people stay and work from home until they have done all that.
So it's good that our panelist has shared, you know, areas of differences and still the further confusion and indecision. The change is happening now. So I think from our point of view, we're having discussions about preparing for the future.
Yeah.
And how do we make those baby steps to move forward? I think it's thrilling and really encouraging listening to you guys and listening to the picture, the reality of where we are, that things are going to come back to a new normal fairly soon, as long as everybody remains vigilant. And it's not us that needs to remain vigilant, it's the rest of the population that's still willing to follow that.
Yeah, because you guys, as I said before, you guys are the experts in it, you know.
Yeah.
You know, from our point of view, we tell the acute leukemics whenever they come out and they want to go to, for example, under normal circumstances on holiday, you know, they think, we always tell them, think more about what you're doing. We want you to do everything and have as normal a life as possible. But think about what you're doing, put a bit more planning into it. So, you know, if you're wanting desperately to go away for a few days, think local and think how you can keep yourself as clean, as socially distant as you can. So you might be looking at more self-catering accommodation, or accommodation that you know that has been deep cleaned beforehand. The hotels will open here and they'll all have been deep cleaned. As Professor McMullen says, they'll be very different. You'll have to book for dinner. There'll only be so many people allowed in the bar. The spas may not be open. But, you know, it's a fluid situation and we'll not know until it's up and running just what's happening.
So from that point of view, as we're following guidelines, these things are coming. And we can start to prepare our minds, if not our bodies, for them yet, and put in place, start doing a little bit of planning. So that's really optimistic. On another note, you know, as we're coming close to the time limit, the future. Anybody got any thoughts about vaccinations and the current treatments for COVID? I mean, I'll be honest with you now. I know we shouldn't compare flu with COVID, but we can compare some of the similarities. Just finishing off that topic in terms of how do we live when we know we don't make antibodies and we're prone to infections in a group, when we know that there are things like flu about, which is quite serious for us. So I can see moving forward that this is going to be quite an easy transition for us once we get past this little bump. Yeah, but
you still get
we're relying on all of those around us. So we're going to be looking for the era in the not too distant future when, if this disease can be vaccinated against, so that those around us protect us. What are your thoughts about moving forward, and then testing and things of that nature? Any thoughts?
So there will be a vaccine, because there's 140 of them in development or something like that. Some of those are going to get through soon. The vaccine, it'll be a killed vaccine. It'll be like the flu. So even though you might not make antibodies, you'll still be getting it, I would have thought. But what you will be looking for is the herd immunity. As soon as there's a vaccine, I think we'll all have our hands up to have it as quickly as possible. And there'll be lots of testing and seeing how effective they are. I hope that it won't be like the flu, that it will be, a vaccine once, and that it won't mutate. And I don't think there's any evidence that this virus is mutating. And in fact, Hugh Pennington, who's a wonderful retired microbiologist, I've heard him saying that there was no second wave from SARS, that, once this goes through, it goes through, but I don't know how true that is. There will be a vaccine, there will be people for it, and be trying to get herd immunity, and I suspect it will be like the flu. You get your flu vaccine, even though you may not make as good as an antibody response.
Yeah, that's helpful, because I think there's as much value in knowing you don't get a response as there is in knowing you do, because if you don't, then you remain vigilant and you carry on with
There's also the question, like when we revaccinate people after transplant, a little response may be better than having not having it in the first place.
But it's a positive note moving forward, is that we could, not in the not too distant future, be in a situation which is very similar to the way we've been living as patients before COVID.
Yeah, I think so. I think there'll be things that will be different. There's different behaviours, but that's always been the way in medicine. Used to be the doctors dressed at their men, of course, in their top hats and coats, and went in and operated. Now, the scrub, they do this, that, and the other. All, things have changed over time, and there will be changes in behaviour. I always joke that I can remember in 1991, the first time I went back to a meeting, and somebody that I didn't really know that well came and gave me this big hug, and kissed me on both cheeks, and being like somebody from strict Northern Ireland upbringing, I thought, what is this? Now, when you are up to this, when you went to a meeting, as I've been doing, you hugged and you shook hands. No, you didn't shake hands. You hugged and you kissed all these people that you didn't know that well. And that is actually behaviour that has come in the last 20 years. Probably from continental Europe. Nothing against hugging and kissing, but it is a change in behaviour. And I think it'll be a long time before anybody goes back to behaving in that way. We might get back to shaking hands, and I think we might be getting to the Asian thing of where you just bow in front of people a little bit. So there'll be changes in behaviour, as there always are, from these public health issues. And we'll just learn to do that. Remember before 9/11, when you didn't have to put all your things in a little plastic bag and your water and so on to go through an airport? Yeah. And we do all that now. We don't go back. We just do all that. Or we did when we were still allowed to go on airplanes.
Well, that's a perfect note for us to end on a positive. I mean, from a patient perspective, I look forward to not having to kiss and hug random strangers. Knowing that I have an immune compromise. It was always very difficult. Somebody tried to throw their arms around me. It's like, get off, So maybe we don't have that to deal with.
Yeah. It's slightly facetious, but behaviour changes will be shaped by this.
I think you're right. And listen, thank you everybody for having me join you. And it's been really uplifting as a patient listening to what you've had to say.
There's hope.
I'll pass it back to Jo.
Yes, absolutely.
There are some resources that maybe Jo can let people know about, but thank you everybody.
Bye.
Joe,
Right.
are you?
Yes, I'm going to. I'm just going to do it now. Let me just share the screen. Can you see that without me going to the slide?
Yep.
I need. There we go. I'm going to do it from there. Is that all right? Without doing the slideshow. Yep. Otherwise it goes back to the beginning. So I just want to finish it off on some of the services, and Nick did touch on them. We've got some fantastic resources here at Leukemia Care. Obviously, one of them you've seen today, and have a look out for some of the new things that we've got coming up. We've done quite a bit on shielding, so we've done England and Wales, and today Northern Ireland on shielding, and we've got another one planned in. We're just finalising for Scotland. We've also got other ones, specific things like things to do with CLL, so watch the website for those, or our Facebook page. We are really good at doing newsletters, which keeps everybody up to speed with what's going on, plus some fun things, and a magazine. A lot of patients have found during lockdown our podcast really interesting. You can find those on our website. Different things from a patient point of view, the exercise, fun things again. And obviously social media. So as I said, we would have normally put this live on Facebook, but we'll make sure we save it and send it out. We've got Facebook, Instagram and Twitter that we use as well. And we have everything on our website. So all our booklets that we normally use, we do hard copies. We also do, you can upload books from there, and everything under the sun that we cover or are talking about now, you will find on the website. So from a support services point of view, we have a helpline, and you'll see the number on the next slide, and we have WhatsApp. So we do get people come to us for general information and help within there. Only is manned, the helpline majority by nurse or nurses, and support staff that are trained up on that. We've also launched virtual support groups. So we have been running face-to-face groups up to lockdown, and we've turned those into virtual support groups, and we're doing really, really well with those. And we've now got over 50. And just to let you know, because I know our regional coordinator, Laura Phillips, is on here today, that we've got a Belfast, or Northern Ireland one really, but based out of Belfast, virtual support group. And that's going to be held, I'm just going to check my notes, on Thursday, the 9th of July at 4 p.m. And that's where patients can come together, and we have, normally lasts about an hour, and we can talk about different topics, have guest speakers, that type of thing. And there will be at some point where we'll go back to face-to-face, but in the interim, the virtual support groups seems to be working really well, because patients can engage and chat, so slightly different to today's format. The other thing is, if you've got any concerns, we've got advocacy support. Within that, obviously, Nick is one of the advocacy team. We've also got newly appointed benefits officer, welfare, so she covers all sides of that. We also have the advocacy officer who will, she will go for patients and advocate for them, whether it be new drugs, or it might be that they're, you know, there's issues that they need raising on medication, that type of thing. We will help them sort that. Nick also mentioned the buddy scheme. That's been going for a couple of years. And again, all this is on the website. We would match anybody that's got a particular leukemia that wants individual support. We will match you up to be with a buddy of the same diagnosis, to chat and talk to on the phone, and maybe sometimes email. And we also have, if you look on the website, we've also got Facebook groups and online forums, such as Health Unlocked. Nick's already talked about the counselling fund, and it is up to £400, so it covers about 6 sessions at the moment. They are running virtually or by telephone, but they prove really helpful for people, especially at this time. So again, you can find the application form on our website. So these are our numbers. If you're interested in the helpline or need any more information, by all means ring the number on the screen. And then for general support, if you prefer to email, just want to ask any questions, use our support line, support by email address, and also anything from an advocacy point, then that's the advocacy email address. So all that remains for me to say is thank you ever so much for everybody that's come on today, particularly our guest speakers. That's Mary Frances, David and Caroline. And fantastic job there from Nick on answering the questions, and we hope to see you all soon. Thank you for coming.
Thank you, everyone. Stay vigilant and enjoy the sunshine whilst it lasts.
Goodbye.
Bye.
All the best.
Bye-bye. Thank you, everybody.